What's the meaning of hepatitis? Hepatitis is a disease characterized by inflammation of the liver. This condition can occur due to viral infection, drinking alcohol habits, exposure to toxic substances, or certain drugs. The type is divided into two based on its nature, namely acute and chronic. Acute hepatitis occurs suddenly over a short period of time, while chronic hepatitis develops slowly and is a long-term condition. So, what's the causes of hepatitis? Hepatitis A, caused by the hepatitis A virus or HAV. It can be transmitted through contaminated food or drinking water. Hepatitis B, caused by the hepatitis B virus or HBV. This type is generally transmitted through body fluids such as blood. Hepatitis C, caused by the hepatitis C virus or HCV, can be caused through sharing needles or sexual intercourse. Hepatitis D, caused by the hepatitis D virus or HDV. Hepatitis D virus cannot reproduce in the human body without hepatitis B. Hepatitis D can be transmitted through blood and other body fluids. Hepatitis E, caused by the hepatitis E virus or HEV. This species is often found in environments that do not have good sanitation due to the hepatitis E virus contamination in water source.
How the hepatitis virus can infect humans. First, begins the entry of the virus into the human body. Then genome translation and processing of polyproteins occurs, which results in genome replications. Subsequently, the assembly and release of particles from the host cell causes infection in humans.
Acute hepatitis often has no noticeable symptoms, so you may not realize you have it. However, if symptoms do develop, they can include muscle and joint pain, yellowing of the eyes and skin, a high temperature, feeling and being sick, feeling unusually tired all the time, dark urine, pale or gray-colored poo, tummy pain, itchy skin, and loss of appetite.
What are the dangers of hepatitis? So, if not treated properly, hepatitis can cause complications such as kidney failure, cirrhosis, or liver cancer, hepatocellular carcinoma, and then anyone from newborns to the elderly can have hepatitis.
How to prevent hepatitis? First, we can get the vaccine for hepatitis A and B, and then practice good personal hygiene such as through hand washing with soap and water, and then don't use uninfected personal items, and then don't share needles to take drugs, and we can drink bottled water when we are traveling. Next, we have treatment for hepatitis. There is no specific treatment for it other than to relieve symptoms like pain, nausea, and itching. So we have to keep it in mind that antivirus drugs cannot eliminate the hepatitis B infection, but only prevent the development of the virus.
It is our responsibility to keep hygiene and wash our hands after using the bathroom and before processing food. Careful about food that uncooked, use condom every time you have sex, and reduce alcohol consumption. We can also prevent it with take vaccination and don't share needles to take drugs. We should not be afraid of this disease. Instead, we should invest in understanding and treating this disease. The more we understand our bodies, the more we can manage hepatitis, said Lai Wong-yu, someone who had hepatitis B almost 30 years ago. No one knows your body better than you do. You are the boss of your health.